Testing is our main defence against the coronavirus, and the earlier you get tested, the better. So it's critical that you recognise the very first symptoms of COVID-19, but sometimes they're not what you'd expect.
We don't really know exactly in what order symptoms present with COVID. Although fever, cough and shortness of breath may be the most common symptoms, if 10 or 15% of patients present with COVID, if we now have several thousand cases in Melbourne, there will be presentations with headache and there will be presentations potentially with conjunctivitis.
Dr Carmel Crock is head of the emergency department at the Victorian and NSW Hospital, and they've had 2 patients who've given them a nasty surprise.
So we had 2 patients present to the NSW emergency department recently with earache and pain on the side of the head, so headache, and they were seen by our ear, nose and throat doctor, who ruled out an ear cause of the pain, and they were then referred to see the eye doctor as well, who tried to rule out eye causes for the headache. One of the patients had a preoperative COVID test, which was positive. So then we saw another case about 48 hours later. And again, that patient, we actually referred for COVID testing, and the COVID testing was positive.
The trouble was that because they didn't meet the testing criteria for COVID-19, at least one of these patients hung around the emergency department for some time rather than being isolated.
These patients came in, they were questioned at triage as to the COVID questions, but they didn't answer positively to any of the COVID questions. So then they're just in the normal emergency department, sitting, waiting, being dilated, moving around the department.
The other symptom that an eye hospital sees a lot of is conjunctivitis, eye inflammation.
In the international literature, COVID can present with conjunctivitis. It means that at the NSW Hospital we've been really particular with our PPE around patients with conjunctivitis in case that's the first presentation of COVID.
If you look at the testing criteria put out by the Department of Health and Human Services in Victoria, headache and other non-respiratory symptoms aren't enough on their own to make you eligible for a test. You also need to have been in contact with a confirmed case, or have just returned from overseas, or be a health or aged care worker.
I think we have to be really humble about it, and I think we have to be open to changing our practice very rapidly.
7:30 asked the department why some known symptoms of COVID-19, such as headaches, aren't enough on their own to allow people to have a test. It did not respond to that question, but in a statement said, and I quote, "Testing criteria are continually being reviewed." So what are the earliest symptoms, and in what order do they appear? A recent study has looked at this and found that there is variation, but for most people, the order seems to go like this: fever, then cough, then sometimes sore throat, muscle aches and headaches, then sometimes nausea, vomiting and diarrhoea. And that's without mentioning loss of smell and taste, red eyes and even a rash. The point from the evidence is that linking COVID too strongly to respiratory symptoms is probably a mistake.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.